Good morning, Virginia. This is Virginia This Morning.
Welcome back to Virginia This Morning. We now turn our attention to a Health Team 6 topic. The importance of regular dental screenings can be a lifesaver. Your mouth is basically the start of your healthy body. And here to tell us more is Dr. Elizabeth Reynolds, a dentist and member of the Virginia Dental Association. Doctor, it's a pleasure to see you. Thanks so much for coming in.
Thank you for having me.
All right, I'm sure you see from A to Z and everything in between when it comes to healthy and unhealthy mouth. We know why. You don't want to get cavities, but it goes beyond just cavities, keeping your teeth clean, correct?
Absolutely. When you come in, I think that what we found is people visit their primary care physician maybe once a year, but they'll see us 2 or 3 or 4 times a year. That gives us an opportunity and kind of a responsibility to be gatekeepers to overall health.
And how and why does your mouth and those pearly whites, how can that affect your entire body?
Your mouth is full of bacteria, and bacteria can spread throughout your body if they're not taken care of. Also, your mouth can be symptomatic of other conditions throughout your regular health.
All right, and then it can lead to actually serious. We're not just talking about cavities and maybe some crooked teeth. We have some images right here. Tell us what this bacteria can lead to, like this. What are we seeing here?
This is oral cancer. Every time you go to the dentist, you may think you're getting just a cleaning, but what your dentist is doing is checking for oral cancer and head and neck lesions. Oral cancer will probably affect around 40,000 people a year. 88,000 of those 40 last year died. The key to that is early diagnosis and early treatment. To treat this successfully, you need to catch it early.
Doctor, what are some of the symptoms for this?
A lot of times there aren't symptoms. We'll just see it. Somebody will show up. They may have a little bit of soreness, but they'll show up and we'll do an exam in their mouth and find something that looks like that, have it biopsied, and it goes from there. And
how do you keep your teeth healthy and just going beyond just the brushing day to day? And how many times should you brush?
2, 3 times a day.
2 or 3 times a day?
Yes, flossing once.
Flossing once, oh yeah. That's flossing, I would imagine, is the big one, right?
The big one.
Okay, we have another image right here. And what kind of disease are we seeing right here?
This is periodontal disease. This is advanced periodontal disease. This can be a manifestation of other conditions as well. When you have this much bacteria in your mouth and this kind of condition, sometimes it can affect your heart. It can affect other parts of your body. Sometimes this can lead to, if you don't get this straightened out, you can end up losing your teeth, which in the long run can also affect your nutrition.
Doctor, is this from a lack of brushing and flossing, or is this hereditary?
It's a combination. It can be a combination of both. So there's often a genetic predisposition to something like that. That combined with lack of care can end up you losing your teeth.
We have a third image right here. This image that we're seeing is periodontal disease?
This is actually gingivitis.
Gingivitis.
Probably not periodontal disease. Gingivitis tends to come from either stress on the system. Sometimes when kids are in school and exams, we'll see this happen. That combined with not taking good care of your teeth. This is almost always reversible.
This stress can actually cause problems with your mouth?
Absolutely.
And
Absolutely.
What are some of the ailments, and what are some of the, I guess, the fixes for something like that?
For gingivitis, just coming in, getting everything cleaned up and taken care of will usually take care of that. Other things we see from stress, the primary thing we see is TMJ disorders. So you'll see your temporomandibular joint, people will clench their teeth and come in with headaches and strain, fractured teeth. That can be treated with a night guard that they wear to protect their teeth at night, or sometimes a day guard.
Doctor, if you ignore your teeth, ignore oral health, how long after that are you going to start to see some effects on your full body?
That's debatable. We don't know. I think the two go hand in hand and not necessarily one causes the other. I don't know that there are instances where oral health can affect your body, but usually that's combined with the immune system is compromised already. And you can see that, and I really don't know exactly what time frame you're talking about, but it certainly can happen.
Oh, and this is one last image. This is what you want your mouth to look at and look like every single day, correct?
Absolutely, yes.
You're a happy dentist when you come in and you can see this, right? All right. Hey, doctor, thank you so much. Nice to see you. Take care of those teeth out there, because it can actually lead to saving your life.
Thanks, and I just did want to say that the Virginia Dental Association has kicked off their educational campaign. It's called Want a Healthy Body, Get a Healthy Mouth. So if you don't have a dentist, go to the website, www.vadental.org. Find a Virginia Dental Association member dentist in your area and go get everything checked out.
Doctor, we're going to put that link right on our website.
Thank
at
you very much.
WTVR.com.
Thanks for having me,
Thank you so much.
Greg.
More information on oral health and the Virginia Dental Association. Just visit us online, as we said, WTVR.com/VTM. Thanks so much for your time, Doctor. I appreciate it. Could be a lifesaver. Cheryl, we'll send it over to you.